can have quite, not all, but some, quite long-term dental and oral impacts. And that means they need ongoing access to a dentist. What are some of the access issues? Because as you've referred to earlier, when we created Medicare in Australia, so this publicly funded medical system, we didn't include the most of the mouth. We didn't include dentistry. So how many people have ongoing access to public dentistry, and how many people are reliant on private dentistry, which must be very difficult to afford for some people?
It is, and it's one of the biggest complexities that I have to think about when I'm referring my patients back, because I can't continue to look after all the patients that have had head and neck cancer, and my colleagues are the same. Look, I think one of the issues is, as you pointed out, the access to public dentistry is limited to people that are pension card holders or healthcare card holders. I think, Julie, the sad reality is that some people, particularly those who've had very extensive cancers that have had chemotherapy and radiotherapy, end up becoming public patients for a number of reasons. They may not be able to go back to work afterwards, and so they end up remaining with us. Some of the patients I continue to see, because their complexity of their oral health after their treatment, particularly if they've had both sides of their mouth and all of their throat irradiated, and they've had chemotherapy as well, they have ongoing issues, and those issues are beyond the scope of a general dentist. So I might have a shared care arrangement where they see their general dentist, but I continue to guide that general dentist ongoing. And some of those patients, even so in South Australia, I can see those patients who are private patients on an ongoing basis. They get billed as private patients even though they're being seen in the public system, but I'm not providing dental treatment. I'm providing, assistance in treatment planning for their general dentist. And there are some people, as you said, that go into the private sector, and they're fortunate enough to have private health insurance, and that covers them. It's that group of people that often don't have private health insurance. They don't meet the public qualifications or the requirements to be access to public care. And dentistry is not cheap. But I often will say to those patients, you must maintain your oral health. You must maintain your oral hygiene, brushing your teeth twice daily. You must go and see a dentist every 4 to 6 months. And if by doing all those things, you're outlaying for a checkup, a clean, an x-ray, and you're preventing a problem, that money is well spent, because you just need one filling, and that will be more than covering the costs of those preventative measures. But that is part of the education process also for the patient at the time of diagnosis. So when I talk to them, I will say, you will have ongoing problems with that thick, ropey saliva you talked about, Julie. Well, I'll give you the measures by which you can manage that. But the most important thing is you're going to have to look after your teeth ongoing, because if you don't, they're going to deteriorate. And so sometimes the treatment planning will be that I'll have to be more aggressive, because the patient will say, I've never looked after my teeth, I don't go to the dentist, I don't want to go to the dentist after this, just take X number of teeth out. So that's part of that informed consent discussion, to educate the patient to understand what they're buying into if we're going to try and save their teeth now.
I'll simply say that before each of us die, we must do everything we can to advocate for the inclusion of the mouth in Medicare for the head and neck cancer patient. I think there is a powerful case for that. I mean that really deeply from the heart, because even as a privately insured person, the gap between what you get back and what you pay is quite significant. And for those people without insurance and who don't qualify for public dentistry, it's a really serious issue. But I'll leave it there if I may.